All right, right on time, just like you guys will experience if you visit any of our doctor's offices, right? So my name's Lee Clinton. I'm the CEO at Titusville Area Hospital. Today we gather to commemorate a significant chapter in the history of our Titusville Area Hospital. This gathering is not just a celebration of milestones, but also a tribute to the countless lives touched, challenges overcome, and the relentless spirit of those who dedicated their lives to healthcare in the community. In the year 1900, a group of determined local citizens recognized the pressing need for accessible medical care in a growing community. They understood that health is not merely the absence of illness, but a vital component of thriving communities. This understanding has been the guiding principle of our hospital ever since. In the decades that followed, Titusville Area Hospital grew and evolved. Over the decades, the landscape of medicine has undergone a profound transformation. The invention of antibiotics brought a new era in treatment. Surgical techniques advanced, and the introduction of modern imaging technology revolutionized diagnosis. The hospital embraced these changes, continually striving to provide the best possible care. Each modification was not merely a response to the progress, but to the commitment of our community's health and safety. As the 20th century unfolded, we witnessed the rise of specialties, with them advancements in pediatrics, surgery, oncology, and many other fields. The Titusville Area Hospital adapted to these changes, enhanced services, and expanded its reach. Throughout the years, the hospital has faced a number of challenges, from economic downturns to the ever-changing landscape of healthcare regulations. We've weathered the storm and emerged stronger. As a matter of fact, there was a time in the not-so-distant past where TAH nearly ceased to exist. The hospital fell in extremely hard economic times in the years spanning from 2008 to 2015 and nearly went bankrupt. Fortunately for this community, in late 2015, Meadville Medical Center took a chance on purchasing Titusville Area Hospital after the big systems declined. When I was recruited to this position in early 2016, Philip Pandoff, who's Meadville Medical Center's president, pledged his support of making Titusville, quote, as robust as we can possibly make it. It's worth noting that that's not the standard playbook for when a bigger hospital acquires a smaller one. Typically what people do is they direct all the volume to the mothership, leaving the smaller facility a shell of its former self. And sometimes they close it completely after a few years of ownership after they've established the referral patterns. There are countless examples of this happening all over the country and including in Western Pennsylvania. Mr. Pandoff made good on his word and fully supported growing services at TAH, allocating financial resources to do so as the needs have been identified and justified. Since 2016, we spent nearly $25 million on capital improvements. We grew the organization from a $22 million a year operation to a $53 million a year operation. In that 9-year period, our hospital outpatient volumes, so our lab, our imaging tests, and all of the hospital-owned physician clinics, we've increased those by over 75,000 encounters per year. That's an increase of over 75,000. And we've completely turned the organization around financially and from a quality perspective. Our salary and wages budget grew from $10.4 million a year in 2016 to $20 million this year. The total economic impact of TAH is estimated by the State Hospital Association to be approximately $82 million a year. Can you imagine this community without those resources flowing through it? Today, we gainfully employ over 300 people with an average annual salary of nearly $70,000 a year. In the next 12 months, we have more on the horizon. We recently purchased the former Rite Aid building on Central Avenue, and we'll be moving outpatient physical therapy, occupational therapy, and speech therapy into that single location. In the existing physical therapy space on Central Avenue, that's where we're going to begin this partnership we have with the University of Pittsburgh Dental School. So in July 26, we're going to bring, we're one of the first of 4 rural general practice dental residency programs that's being established across the Commonwealth. As part of this program we'll be bringing training for dentists, dental hygienists, and dental assistants all right here to Titusville. These programs should not only provide additional access to dental care in the immediate term, including those patients that are on medical assistance, which many private dentists do not take, but also to add a supply of dental providers to the region in the intermediate and long term. In the last 12 months, we've replaced a retiring part-time ENT with a full-time ENT. We have another full-time ENT coming in the next couple of months. We're bringing on a full-time audiologist to offer the breadth of hearing evaluation and hearing aid services. In January, we're going to have a full-time dermatology nurse practitioner starting here in Titusville as an extension of Meadville Dermatology. We added a new internist last month, internist and hospitalist, Dr. Sean Leslie. We've added multiple mental health providers, and we're continuing to add another one in the next month. A lot of things have been happening, and a lot of things continue to happen that are really exciting here in Titusville. In closing, the modern Titusville Area Hospital is equipped with state-of-the-art technology, staffed by a dedicated team of healthcare professionals who embody the spirit of our founders. Every doctor, nurse, technician, and support staff member plays a vital role in this mission, and we employ a lot of really great people. They are the heart and soul of this organization. Let us support the continued growth and evolution of this vital institution. Together, we can ensure that it remains a source of care, comfort, and hope for generations. Thank you for being here today and for taking part of this remarkable journey. Before we move down the hall to the other festivities and unveiling the history wall, I think we have some proclamations to do. But right before we do that, I do want to acknowledge Michelle Burdick and Kelly Clark, who, when you guys see the wall and these items that are out in the hall, they spent a lot of time combing through the archives, looking through the scrapbooks, and they're the ones that identified what was meaningful, worked with the vendor, had this wall created, and I think when you guys see it, you guys are going to be really impressed, because I know I am. So Kelly and Michelle, thank you very much. So, right, proclamations?
Yes. Stay right there, that would be wonderful.
Sure.
My name is Julie Hecker, and I work with State Senator Michelle Brooks, and I'm here with a Senate citation to share, and because the senator was not able to join you folks today, she sent a personal letter. I'm just going to read a short snippet of it and the citation. What strikes me most is the dedication of this hospital staff, administration, and the community to ensure it has a local hospital for its citizens in their greatest times of need. With this mindset, I have no doubt the Titusville Area Hospital and Meadville Medical Center will continue to explore innovative ways to continue to provide the compassionate, high-quality medical care our families have relied on for more than 12 decades. Now, therefore, the Senate of the Commonwealth of Pennsylvania congratulates the Titusville Area Hospital upon its richly deserved recognition, extends warmest wishes for a future replete with ever-increasing success, and directs that a copy of this document, sponsored by Senator Michelle Brooks, be transmitted to the Titusville Area Hospital, 406 West Oak Street, Titusville, Pennsylvania.
Thank you.
Congratulations.
Thank you.
Good afternoon. The Crawford County Commissioners appreciate the fact that we were sent an invitation, and it's always a nice trip to come all the way over here to Titusville. The county commissioners are in regular contact with administration from Titusville and from Meadville Medical Center. Meadville Medical Center, at least once or twice a week, we do talk to administration from there. 7 days a week, I talk to administration from Titusville. And for those of you that don't know, I'm married to Kim Shell. So she keeps coming home. So we have a proclamation we'd like to read. Whereas Titusville Area Hospital has dutifully served the Oil Creek region routine and emergency medical needs since 1900. And whereas, while rural hospitals across the Commonwealth are seeing extensive cutbacks and closures, Titusville Area Hospital has continually enhanced and added service to better fit the requirements of the local residents. And whereas generations of unwavering professionals have dedicated their resource, expertise, and careers to the continued survival and growth of the vital medical services provided by this facility. Now, therefore, let it be proclaimed that we, the undersigned commissioners of Crawford County, do hereby recognize and congratulate Titusville Area Hospital, as well as its staff, administration, and volunteers on the occasion of its 125th anniversary. On behalf of the citizens of Crawford County, we commend and salute the efforts of all involved to preserve this vital community asset. It is our sincere hope that the high-quality medical care offered to the Titusville region will continue for years to come and continue to be a model for excellence in rural health care. Submitted by Commissioner Eric Henry, Commissioner Chris Seeley, Commissioner Scott Schell. Thank you, sir.
Okay, again, thank you all for coming. I really, really appreciate the support. It's great to see this kind of turnout. So, if everyone could stand up, we're going to move down the hall. We're going to unveil the history wall, and then after that, we have refreshments and food and some other fun things in the cafeteria. So we'll go down the hall, see the new wall, then move to the cafeteria. Thank you very much.
5, 4, 3, 2, 1.
Step back and out of the way. How are you guys doing?